as a kidney specialist, I see a lot of type 2 diabetes because that is really by far and away the most common cause of kidney disease. And the thing about it is that I think really we treat the entire process quite incorrectly. So we treat people when they develop their kidney disease, and then we put them on dialysis and so on. But what I learned through seeing the patients was that there's really very little you can do at that point. It's like trying to fix a car after it's kind of broken down and you haven't changed the oil for 15 years sort of thing. It's very hard at that point to do it. And the key actually is in the very name itself, diabetic kidney disease. If you have diabetic kidney disease, you can't develop it if you don't have type 2 diabetes. So that's what made me very interested in trying to reverse type 2 diabetes, because the whole point is that we try to tell people that it's a chronic and progressive disease, but it's actually not true at all, because if you think about it, it's really reversible. If you have a friend, for example, who is diagnosed with type 2 diabetes, then they lose like 50 pounds. You and I both know, and everybody else knows too, that type 2 diabetes almost invariably goes away. So it's not actually a chronic and progressive disease, it's a reversible disease, but the mistake that we made was that we took a disease which is primarily a dietary disease, and we treated it with a lot of drugs. And we never corrected the underlying dietary condition, so the condition continues to worsen because we've actually done nothing about it. We've thrown a lot of drugs at it, and then as doctors what we did is we said, well, I wonder why my patients are getting worse. I threw a lot of drugs at it. And therefore it must just be a chronic and progressive disease. But it was just a big lie that the healthcare system tells itself so that they don't have to face the fact that the patients are actually getting worse. And we see that every day. If you look at the obesity epidemic, if you look at the type 2 diabetes epidemic, if you look at the population on dialysis, everything is skyrocketing. So clearly we have not been successful in preventing this disease, which is a preventable disease. And that's the one thing that we have to understand. So you have to go back to the root cause, which is you have to treat the type 2 diabetes, you have to reverse it, and part of that is losing weight. And that's where I wrote the obesity code and the diabetes code, and I also co-wrote the complete guide to fasting for strategies to lose weight, because you have to prevent these diseases, these kidney diseases, and I never want to put people on dialysis. I'd rather treat them when they have their type 2 diabetes, reverse that, and then they don't have to worry about all the downstream complications.